But here's what most men over 50 never say out loud. You wake up tired, even after a full night in bed. You're making more trips to the bathroom. Your energy feels unpredictable. And somewhere in the back of your mind, you wonder if your private habits are quietly working against you. I'm a board-certified urologist, and I've treated thousands of men who are afraid to ask this exact question. Today, I want to share a surprising truth about daily masturbation and your prostate, because the real issue isn't what you've been told. Tell me where you're watching from, and if this matters to you, gently like and subscribe so we can keep this conversation going together. But here's what most people don't realize about this fear. It doesn't come from the body first, it comes from the mind. I see it every week in my office. Men in their 50s, 60s, even 70s sit across from me, lower their voice, and ask a question they've been carrying silently for years. Doctor, could masturbation be harming my prostate? This worry almost always appears around midlife, right when the body starts changing in ways that feel unfamiliar and unsettling. Urinary changes, slower mornings, less predictable erections, and when those changes happen, the mind looks for a cause it can control. After 50, the prostate suddenly becomes something you're aware of. Before that, most men never think about it. But now, you're waking up at night to urinate. Your stream isn't what it used to be. There's pressure, discomfort, sometimes anxiety before bed because you don't want to be up again in 2 hours. And when these symptoms show up, many men instinctively connect them to sexual behavior, especially masturbation, because it's private, frequent, and rarely discussed openly with a doctor. Silence creates space for fear to grow. Culturally, men have been fed confusing messages for decades. Some say masturbation is harmless. Others claim it drains vitality, weakens masculinity, or inflames the prostate. Online headlines don't help. You've probably seen them yourself. Dramatic claims warning that daily ejaculation overworks the prostate or causes chronic inflammation. These headlines are designed to trigger fear, not understanding. They take complex biology and reduce it to a blame story. And unfortunately, many men internalize that story quietly. What's striking is how rarely this topic comes up directly during regular checkups. Men don't ask it out loud. Instead, they hint at it. They'll say, could something I'm doing be causing this? Or, is it normal at my age? And often, it's only after I reassure them that the question finally surfaces. That tells you something important. This fear isn't about recklessness. It's about responsibility. These are men who care about their health and don't want to unknowingly make things worse. One of the most common beliefs I hear is that masturbation causes inflammation of the prostate, that ejaculating too often somehow irritates or exhausts it. Others believe it leads to weakness, hormonal depletion, or long-term damage. These ideas feel logical on the surface. If something is used often, maybe it wears out. If symptoms worsen, maybe a habit is to blame. But the human body, especially the prostate, doesn't operate on moral logic or punishment. It operates on physiology, patterns, and context. Another reason men associate prostate symptoms with sexual behavior is timing. Prostate enlargement, urinary symptoms, and sexual changes tend to appear in the same decades of life. That overlap creates a false connection. When two things happen around the same time, the brain links them. I remind my patients that correlation does not mean causation. Aging brings hormonal shifts, changes in blood flow, muscle tone, inflammation levels, and metabolic health. Masturbation often becomes the scapegoat because it's visible and emotionally charged. From my perspective as a urologist, the most important thing is to normalize the concern without feeding the fear. You're not wrong for wondering. You're not weak for asking. But you don't need to punish yourself or carry shame about a normal human behavior. The prostate doesn't respond to guilt, restraint, or self-judgment. It responds to patterns, sleep quality, stress levels, inflammation, movement, metabolic health, and yes, sexual habits, but only as one small piece of a much larger picture. This is where myth and reality begin to separate. The myth says, this behavior is harming you. Reality says, your body is giving you signals and they need proper interpretation. When men frame prostate health through shame-based logic, they miss the real contributors and delay meaningful improvement. When they frame it medically, calmly, and honestly, clarity replaces fear. A simple but powerful step is becoming aware of where your information comes from. Sensational videos, anonymous forums, and fear-driven headlines are not substitutes for evidence or clinical experience. Your body deserves better than internet panic. When you approach prostate health through a medical lens instead of a moral one, the anxiety softens and smarter questions emerge. And this brings us to a critical turning point, because once you understand why this fear exists, you can finally look in the right direction. But here's where most men are looking in the wrong direction, and it's not masturbation itself. But here's what most people don't realize once we step away from fear and into science. Your prostate is not a fragile organ waiting to be damaged by normal sexual activity. It's a gland designed to function, to produce fluid, and to respond to regular physiological signals. When we talk about ejaculation and prostate health, we're not talking about morality or restraint. We're talking about plumbing, circulation, hormones, and balance. And when men understand that, the anxiety often dissolves almost immediately. Let me explain the prostate in simple terms. Its primary role is to produce a fluid that becomes part of semen. That fluid doesn't just appear and disappear on its own. It's made continuously and is meant to be released periodically. Ejaculation is one of the natural ways that release happens. From a purely physiological standpoint, ejaculation acts more like drainage than irritation. It allows built-up fluid to exit, reduces congestion, and supports healthy circulation within the gland. That's very different from the idea that ejaculation somehow inflames or exhausts the prostate. This is where science offers reassurance. Several large observational studies have examined ejaculation frequency and prostate health over time. When researchers looked at men who ejaculated regularly compared to those who rarely did, they did not find evidence that frequent ejaculation damages the prostate. In fact, some studies suggest the opposite. Men with more regular ejaculation across adulthood showed a lower risk of developing certain types of prostate cancer later in life. Now, that doesn't mean ejaculation is a cure or a guarantee, but it does challenge the fear-based narrative that more is harmful. I'm careful with how I explain this to my patients. Science doesn't say you need to ejaculate a certain number of times per week to be healthy. It also doesn't say that more is always better. What it shows is that normal, regular ejaculation appears to be neutral to potentially protective for the prostate in many men. That alone should ease the worry that masturbation by itself is inherently damaging. However, context matters, especially as you age. A man in his 20s has a different hormonal environment, recovery capacity, and stress load than a man in his 50s, 60s, or 70s. Testosterone rhythms change, sleep becomes more fragile, inflammation rises more easily. So while the prostate doesn't suddenly become vulnerable to ejaculation, your overall system becomes more sensitive to imbalance. That's where moderation comes in, not abstinence or fear. One distinction I make very clearly is the difference between healthy frequency and compulsive behavior. Healthy frequency feels natural. It doesn't interfere with sleep, energy, motivation, or daily life. Compulsive behavior, on the other hand, often shows up alongside stress, loneliness, anxiety, or poor sleep. In those cases, masturbation isn't the cause of prostate issues, but it can be a signal that something else in the body or mind is out of balance. This is where men sometimes get confused. They notice fatigue, brain fog, or low motivation and assume ejaculation is draining them. In reality, the underlying issue is often poor sleep, chronic stress, insulin resistance, or hormonal shifts that are common after midlife. Ejaculation gets blamed because it's the most obvious event, but it's rarely the root problem. When we correct the deeper imbalance, those post-ejaculatory symptoms often disappear without changing sexual habits at all. The most empowering takeaway here is this: fear is replaced by informed moderation. You don't need rigid rules or internet formulas. You need awareness. Pay attention to how your body feels afterward. Do you recover well? Do you sleep deeply? Do you wake up clear-headed? Your body gives feedback if you listen without judgment. That feedback is far more reliable than any headline or comment section. As a doctor, I encourage men to view ejaculation as one small variable in a complex system. It's not an enemy. It's not a magic solution either. It's simply part of how the male body functions. When you understand that, you stop asking, "Is this hurting me?" and start asking, "What is my body trying to tell me overall?" And that question leads us to something even more important, because frequency alone doesn't tell the full story. The why behind the habit matters more. But here's what most people don't realize once the physical explanation stops making sense. Sometimes daily masturbation isn't about the prostate at all. It's about what's happening in the nervous system, the hormones, and the quiet emotional pressures you carry every day. When I look deeper with my patients, especially men over 50, the pattern often shifts from a physical concern to a stress signal the body is sending, one that's easy to miss if you're only focused on the habit itself. For many men, masturbation becomes a reliable way to unwind. It releases tension, it distracts from worry, it provides a short burst of pleasure and relief at the end of a long day. There's nothing inherently wrong with that. But neurologically, it activates dopamine, the same chemical involved in motivation, reward, and focus. When life feels repetitive, stressful, or emotionally flat, the brain naturally seeks easy dopamine. This is especially common after retirement, career changes, or periods of isolation when structure and stimulation quietly fade. The issue isn't the behavior, it's the pattern. When masturbation becomes the primary way your brain copes with stress or boredom, it can start to affect how energized and motivated you feel afterward. Dopamine spikes followed by drops can leave you feeling flat, foggy, or unmotivated, especially if your baseline health is already strained. Men will tell me, "I feel fine in the moment, but afterward, I just don't have the drive I used to." That's not damage, that's feedback. Hormones play a role here too. Testosterone isn't just about libido or muscle. It follows a daily rhythm and is closely tied to sleep quality, recovery, and stress levels. Poor sleep, especially fragmented sleep, lowers testosterone more reliably than sexual activity ever could. If you're ejaculating late at night, sleeping poorly, and waking up tired, the fatigue you feel isn't because you ejaculated. It's because your recovery system never fully resets. I see this misunderstanding all the time in my practice. Men come in convinced that sex or masturbation is draining them, when in reality they're dealing with undiagnosed sleep apnea, elevated blood sugar, or chronic inflammation. One patient blamed himself for years, reducing intimacy and carrying guilt, only to discover his real issue was severe sleep apnea. Once treated, his energy returned and the fear vanished. The habit didn't change, the physiology did. Insulin resistance is another silent player. As men age, blood sugar control often worsens without obvious symptoms. This affects energy, mood, and hormone balance. When insulin resistance is present, recovery after any pleasurable activity feels harder. Again, masturbation becomes the easy target, but it's not the cause, it's the messenger. What I want you to hear clearly is this: feeling drained doesn't mean you're harming yourself. It means your system is under-resourced. Stress, poor sleep, lack of movement, and metabolic strain all pile up quietly. Masturbation simply becomes the moment when you notice the deficit. Blaming the habit delays the real solution and adds unnecessary shame. A simple self-check can be powerful. After ejaculation, ask yourself, how is my energy the next morning? How did I sleep? Do I feel calm or restless? Do I recover easily, or does everything feel heavy? These questions tell you far more than counting frequency ever will. Your body is communicating, not condemning. When you reframe masturbation as feedback instead of failure, something shifts. You stop fighting yourself and start listening. You move from self-judgment to self-awareness, and that awareness opens the door to addressing what truly matters for long-term health, confidence, and prostate well-being. Because once you understand this connection, it naturally leads to the real prostate risk most men never hear about. But here's what most people don't realize until we step back and look at the whole picture. The real threat to the prostate after 50 isn't masturbation, and it isn't ejaculation frequency. It's the slow, quiet build-up of conditions that most men were never taught to watch for. These drivers don't announce themselves loudly. They creep in over years, often disguised as just getting older, and by the time symptoms show up, men are already blaming the wrong thing. The first and most powerful driver is chronic inflammation. As we age, low-grade inflammation becomes more common, especially when sleep, diet, and movement decline. The prostate is particularly sensitive to inflammatory signals because it sits at the crossroads of hormones, blood flow, and the immune system. When inflammation is high, the prostate can swell, become irritated, and contribute to urinary symptoms. Masturbation doesn't create this inflammation. Poor metabolic health, stress, and systemic inflammation do. Sleep is another overlooked factor. Poor sleep doesn't just make you tired. It disrupts hormone regulation, increases inflammation, and worsens prostate symptoms. Many men find themselves trapped in a nocturia loop. You wake up to urinate, which fragments sleep. Fragmented sleep worsens inflammation and hormonal balance, which then increases nighttime urination. It becomes a self-reinforcing cycle. When men notice symptoms after sexual activity, they assume causation, but the real issue is sleep quality that was already compromised. Insulin resistance and abdominal fat play a much larger role than most men realize. Excess visceral fat produces inflammatory chemicals that directly affect the prostate. It also alters testosterone and estrogen balance, contributing to prostate enlargement and urinary changes. I often see men who are physically active in their minds, but sedentary in reality, sitting for long periods with minimal movement. That combination increases pelvic congestion, reducing healthy circulation to the prostate and surrounding tissues. A sedentary lifestyle doesn't just weaken muscles, it slows blood flow in the pelvis. The prostate thrives on good circulation. Movement helps drain congestion, reduce inflammation, and support normal function. When men sit for hours each day, circulation suffers, symptoms follow. Again, masturbation becomes the easy suspect because it's the last noticeable activity before discomfort appears. This misattribution is understandable. When symptoms show up, the brain looks for something recent and personal to blame. Sexual behavior fits that narrative neatly. But when men focus on the wrong cause, they miss the opportunity to improve what actually matters. I've seen countless men restrict intimacy, carry guilt, and live in fear while the real drivers go unaddressed. The empowering truth is this: these factors are modifiable. You have far more control than you've been led to believe. Improving sleep quality, reducing inflammation through movement and nutrition, managing blood sugar, and staying physically active do more for prostate health than avoiding masturbation ever could. When men shift their attention to these priorities, symptoms often improve naturally, without shame or restriction. A few simple behavioral priorities can make a meaningful difference. Prioritize consistent sleep. Move your body daily, even if it's just walking. Reduce prolonged sitting. Address weight gain around the abdomen. Manage stress proactively instead of numbing it. These aren't dramatic interventions, but they're powerful when applied consistently. When you speak to a urologist, these are the conversations that matter. Ask about inflammation markers. Ask about sleep quality and nocturia patterns. Ask about metabolic health and lifestyle contributors. A good physician will welcome these questions and help you see the bigger picture rather than focusing on one isolated habit. And once you understand this, something shifts emotionally. Fear gives way to clarity. Shame gives way to agency. You realize you're not broken and you're not too late. Now here's the part I want you to hear very clearly, because this is where hope comes in. But here's what most people don't realize once fear has had the final word for too long. It's not too late. Not at 55, not at 65, and certainly not at 75. I say this not as encouragement for the sake of comfort, but as a physician who has watched men reclaim their energy, confidence, and sense of control far later in life than they ever thought possible. Aging is real, but surrender is optional. If you're carrying regret, embarrassment, or quiet fear about your body, you're not alone. Many men feel they should have known better, acted sooner, or taken better care of themselves. That kind of thinking keeps you stuck in the past. The body doesn't respond to regret. It responds to what you do next. And the truth is, your system is far more adaptable than you've been led to believe. I want to normalize something important. Change after 50 doesn't look like reversal. It looks like stabilization, improvement, and resilience. You may not feel 25 again, but you can feel clear-headed, rested, steady, and confident. You can reduce symptoms. You can sleep better. You can enjoy intimacy without fear. Progress doesn't require perfection. It requires consistency and compassion toward your own body. When I sit with patients in my office, the moment things begin to shift is when they stop seeing themselves as broken and start seeing themselves as capable. If you were sitting across from me right now, I wouldn't lecture you. I wouldn't shame you. I would tell you that your body is giving you information, not issuing a verdict. Together we would focus on restoring balance, not chasing impossible ideals. Agency is one of the most powerful medicines we have. When men realize they can influence their sleep, energy, inflammation, and hormone rhythms through daily choices, confidence returns. Small changes compound. Better sleep improves hormones. Movement improves circulation. Reduced stress improves recovery. These changes don't happen overnight, but they happen reliably when approached with patience. Masculine dignity isn't about toughness or denial. It's about responsibility without self-punishment. It's about taking care of what's yours without fear. When you treat your body as an ally instead of an adversary, anxiety softens and clarity takes its place. You deserve to feel grounded in your own body again. You deserve mornings with more energy and nights with less worry. And most importantly, you deserve accurate information that empowers rather than frightens you. This moment isn't the end of something. It's the beginning of a smarter, calmer, more confident relationship with your health. But here's what most people don't realize as we bring this conversation full circle. The question you started with was never really about masturbation. It was about whether you could trust your body and whether you were unknowingly harming yourself. Now you know the truth. Daily masturbation by itself is not the enemy of your prostate. Fear, misinformation, and ignoring the real drivers of health are what quietly do the damage. I want to thank you for staying with me through this discussion. Men like you who are willing to listen, reflect, and learn are exactly who this channel is for. Education replaces fear. Understanding restores confidence. And when you know what truly matters, you can take action without shame or anxiety. If you found this valuable, join our community and subscribe so you never miss future guidance designed specifically for men like you. This isn't about trends or hype. It's about clear, honest conversations that help you protect your energy, your sleep, your vitality, and your long-term health. You deserve confidence in your decisions. You deserve deep, restorative sleep. You deserve to feel steady in your body and clear in your mind as you age. Taking care of your health isn't selfish, it's responsible, and it's never too late to start doing it the right way. Stay connected, stay curious, and stay proactive. I'll be here to guide you through what matters most, with science, clarity, and respect. Take care of your health because you are worth it.